Hello guys, look at this question here. Causes of obstructive jaundice. They have asked for 3 marks. So this is obstructive jaundice that they are asking about. So the obstructive jaundice is nothing but the post-hepatic. Post-hepatic, after the liver some problem because of which there is some obstruction, because of which what is there? Jaundice. Okay. So what are the causes for this obstruction they are asking? So now let's get started. So in jaundice, what is jaundice? Bilirubin levels, serum bilirubin levels greater than 3 mg per deciliter. So scleral icterus in the eye, you can see the in the sclera you can see the icterus, that yellow color, yeah, discoloration of the sclera. So in natural light, if you see the eye, you will be able to see this icterus. So jaundice you have understood, and in that there are 3 types. What are the 3 types of jaundice? You have the prehepatic. Prehepatic means before the liver some problem. That means what? There is hemolysis, like newborn will have all this, right? So the liver is fine. Before the liver some lot of hemolysis, so lot of workload on the liver, so there can be jaundice. Then you have what is called as hepatic. Hepatic jaundice. Hepatic means what? The problem is what? Focus guys. Where is the problem in hepatic? It is with the liver. But have they asked these two in the exam? No. What they have asked you in the exam is obstructive jaundice. Okay, so obstructive jaundice is nothing but post-hepatic jaundice. Okay, so here what is happening? The problem is all here after the liver. Liver is perfectly fine. There's no problem with blood. Blood is not having any hemolysis or anything. But here there is some obstruction. So why will there be obstruction? So think about it. Why do you think there will be obstruction? So all the structures around the liver, right, will cause the problem. So the liver is perfectly fine. I'm telling you, the liver is perfectly fine. Okay, then below the liver, what do you have here? You have the, gallbladder, right? So, so you have the hepatic ducts, then you have the cystic duct, then you have the bile duct, right? So, somewhere here there is obstruction. I mean, why is there obstruction? Because of the structures around it. What are the structures around it, guys? You have the pancreas. In female, you might have a growing uterus. Then there may be, what else? Whatever is putting pressure here, could be stones here, right? So these are the causes you will write, and you will get the 3 marks that you want. What are the causes? So look at the causes here now. Canalicular, that means something to do with these canals. So you should first of all know the anatomy, right? Do you know the anatomy? Hepatic duct, cystic duct, then you have the bile duct. Okay, that will join the pancreatic duct and that will open into the duodenum. So you can have here, you think about, I already told you, pregnancy or uterus, obstetric cholestasis can happen. Because of that, there can be obstruction. Pregnancy, you understood. Then hepatitis, the liver inflammation. Cirrhosis of liver, obviously this also you can understand. Lymphoma, some tumor, some kind of a tumor, yeah. Bacterial sepsis. Sepsis is obstructing, interesting. Idiopathic, you have no idea why. Very nice. And then some drugs like erythromycin, chlorpromazine, chlorpamide. Okay, sorry, chloropropamide. Where do you get this? I've never heard this chloropropamide. Guys, this chloropropamide is coming here, guys, under antidiuretic. Chloropropamide. I never used this actually. So chloropropamide comes here. Antidiuretic. So we will make it in our notes. So we will not again come back again and again and read. This is an antidiuretic. What is chlorpromazine? I'm thinking it's an antipsychotic, right? Psychotic, I'm thinking. Then erythromycin, I know, is an antibiotic. Which type of antibiotic is it? It's a macrolide antibiotic, okay? So, canalicular, okay? The canals, all these canals, and which canals you draw this diagram, you will get very good marks. So draw the hepatic duct, cystic duct, that will become bile duct joins pancreatic duct and opens in duodenum. So somewhere here, everywhere obstruction is there, okay? So this is canalicular. Biliary means main thing they're talking about is gallbladder, right? Inside the gallbladder, some calculi. What do you call this? Cholelithiasis. Carcinoma of pancreas. Guys, this is very important. You have to write this in the exam, okay? Pancreas cancer. Tumors, we already told you some kind of a lymphoma is there here. It could be benign metastatic tumors, strictures because of some kind of a some narrowing. That is what is stricture, right? Biliary cirrhosis. Okay, this is not liver, hepatic cirrhosis. No, they are talking about biliary cirrhosis. Okay. Then what else? So main thing you won't forget is the duct will have stones, the gallbladder has stones, there is carcinoma of head of pancreas. Okay, there is a biliary stricture, cholangitis, sclerosing cholangitis, pancreatic pseudocyst. See, these are very important to write. Okay. So what you should not forget, blame the pancreas, blame pregnancy, blame hepatitis, the liver is enlarged, the gallbladder stones, then tumors, strictures. Mainly don't forget the drugs, erythromycin, chlorpromazine, chloropamide, which is an antidiuretic. Okay. What else? Idiopathic you write off. Okay. We really don't know why it happens also. Okay. So obstructive post-hepatic jaundice. Pregnancy, very important, obstetric cholestasis. They will have itching of palms and soles and you have to identify, otherwise the fetus will die. You have to treat this person to reduce this bile. Okay. So in the exam they have asked only what? Causes of obstructive jaundice, post-hepatic jaundice. But in the end you can write treatment, medical treatment, ursodeoxycholic acid. Okay. Ursodeoxycholic acid, UD live. Okay. Thank you.